As we age, our bodies undergo numerous changes, including how we process and absorb nutrients. Vitamins that once supported our health in youth may now pose hidden dangers. While many seniors trust vitamins to protect their health, it's crucial to recognize that not all supplements are beneficial as we grow older. In fact, certain vitamins, when taken in excessive amounts, can do more harm than good. For instance, high doses of vitamin A, long known for its role in supporting vision and immune function, can lead to liver toxicity and weakened bones in seniors. Similarly, excessive vitamin E, often taken for its antioxidant properties, can dangerously thin the blood, increasing the risk of stroke. Vitamin B6, commonly used to support mood and energy, can cause nerve damage when consumed in excess, leading to balance issues and a loss of independence. Even vitamin C, widely regarded as a key immune booster, can stress the kidneys and contribute to kidney stones if overused, especially in seniors with declining kidney function. While these vitamins may seem harmless, it's important to understand the potential risks they pose in higher doses. However, the good news is that there are vitamins that seniors should embrace as part of their daily routine to promote better health and well-being. Vitamin D, essential for bone strength and immune function, is critical as we age, especially since our bodies become less efficient at producing it from sunlight. Vitamin B12 is crucial for preserving memory, energy, and mental clarity, especially as deficiencies become more common in older adults. Vitamin K2 plays a vital role in bone and heart health by guiding calcium to the bones and preventing its harmful buildup in the arteries. Lastly, magnesium, often overlooked, is essential for muscle relaxation, nerve function, and overall stress relief, making it a key nutrient for daily comfort and health. The key to aging gracefully is not about avoiding all vitamins but rather choosing the right ones in the right amounts. By being mindful of which vitamins are beneficial and which ones may be harmful, seniors can enhance their quality of life, prevent unnecessary health complications, and maintain a sense of independence and vitality for years to come. The path to healthier aging is one of knowledge, awareness, and thoughtful decisions, choices that empower us to live with strength, clarity, and peace of mind. 4 dangerous vitamins for seniors. 1. Vitamin A high doses. Vitamin A has long been celebrated for its vital role in supporting vision, immune function, and skin health. In younger years, it helps maintain healthy eyes, a robust immune system, and even assists in cell growth and repair. However, as we age, our bodies no longer process vitamins in the same way, and the very vitamin that once offered protection can become a silent threat when taken in excess. This is especially true for seniors who might still rely on vitamin A supplements as part of their daily health routine. For older adults, particularly those over the age of 60, high doses of vitamin A can be problematic. The liver, which is responsible for processing fat-soluble vitamins like vitamin A, begins to slow down with age. In the past, the liver efficiently filtered out excess vitamins, but as it becomes less effective, these vitamins accumulate in the body over time. When taken in large quantities, vitamin A, especially in the form of retinol supplements, can cause toxicity. The liver, already burdened by years of processing various substances, becomes inflamed and fatigued, struggling to clear the excess vitamin. This buildup can have far-reaching consequences for senior health. One of the most concerning effects of excessive vitamin A is its impact on bone health. As we grow older, maintaining bone density becomes increasingly important, as bones naturally lose strength with age. However, high doses of vitamin A can interfere with vitamin D, a crucial nutrient for calcium absorption, which is essential for strong bones. Research has shown that too much vitamin A can hinder calcium's ability to be absorbed properly, making bones more fragile and susceptible to fractures. This is particularly dangerous for seniors, whose bones are already at risk for osteoporosis and fractures. The very supplement they may be taking to support their health can unknowingly set the stage for debilitating falls and broken bones. Moreover, the toxicity caused by excess vitamin A can lead to a range of other subtle symptoms that might go unnoticed at first. Seniors might experience fatigue, irritability, or even pain in their joints, but these signs are often brushed off as normal aging. However, these seemingly minor symptoms could be early indicators of vitamin A toxicity. A dull ache in the side, A bruise that doesn't heal, or a sudden stumble that results in a fracture can be linked back to excessive vitamin A intake. Unfortunately, the connection is not always made, and by the time the damage is apparent, it may be too late. Given these risks, it's important for seniors to reconsider their use of vitamin A supplements, particularly high-dose multivitamins or retinol. While vitamin A can certainly benefit the body when taken in appropriate amounts, excessive intake is not only unnecessary but potentially harmful. Instead of reaching for high-dose vitamin A supplements, seniors should focus on obtaining this vitamin from natural food sources, such as carrots, sweet potatoes, and leafy greens, which provide the body with a safe, balanced dose of vitamin A without the risk of toxicity. By making mindful choices and consulting healthcare providers, seniors can better navigate the complexities of supplementation and safeguard their health. 2. Vitamin E high doses. Vitamin E has long been hailed as an antioxidant powerhouse, a nutrient capable of reducing the effects of aging, preventing heart disease, and even fighting certain types of cancer. It is commonly promoted as a tool to boost skin health, improve circulation, and preserve overall vitality. For many seniors, vitamin E seems like a natural addition to their daily regimen to maintain a youthful appearance and strong immune system. However, when taken in high doses, vitamin E can become a silent threat, increasing the risk of serious health complications that can outweigh its potential benefits. While vitamin E is essential for maintaining healthy cells and protecting the body against oxidative damage, excessive intake, especially in doses greater than 400 IU per day, can thin the blood to dangerous levels. This can pose significant risks for seniors, especially those who are already taking blood-thinning medications such as aspirin, warfarin, or other anticoagulants commonly prescribed to manage heart disease, stroke, or blood clots. The interaction between high doses of vitamin E and these medications can compound the blood-thinning effects, increasing the risk of uncontrolled bleeding and potentially life-threatening hemorrhagic events. The most alarming risk associated with high-dose vitamin E is its potential to cause hemorrhagic strokes. A hemorrhagic stroke occurs when a blood vessel in the brain ruptures, leading to severe bleeding and, in some cases, permanent brain damage. Unlike ischemic strokes, which are caused by blockages, hemorrhagic strokes strike suddenly and without warning. The thinning effect of vitamin E on the blood can exacerbate this risk, making it more likely for a vessel in the brain to rupture, even from relatively minor causes such as a fall, head injury, or sudden movement. Research has shown that the risk of hemorrhagic stroke increases with high doses of vitamin E. A study published in the Annals of Internal Medicine found that seniors who took more than 400 IU of vitamin E daily had a higher incidence of hemorrhagic stroke compared to those who took lower doses or none at all. This study, along with other clinical trials, indicates that while vitamin E is beneficial in smaller amounts, its excessive consumption could have devastating consequences. For many seniors, this is a serious consideration, as they may be unaware of the potential risks associated with the vitamins they take daily. In addition to the risk of stroke, excessive vitamin E intake can also lead to other bleeding-related complications. Seniors who take high doses of vitamin E may experience easy bruising, nosebleeds, or prolonged bleeding after injuries or surgeries. In extreme cases, excessive vitamin E can result in internal bleeding, which may not be immediately visible, but can cause long-term health issues if left untreated. The danger of vitamin E toxicity is compounded by the fact that it is a fat-soluble vitamin, meaning that the body stores it for longer periods. Unlike water-soluble vitamins that are easily excreted through urine, fat-soluble vitamins like vitamin E accumulate in the body over time. This can lead to a gradual buildup that may not show symptoms right away but can be harmful in the long run. Over time, this accumulation can put additional strain on the body's organs, especially the liver, which has to process the excess vitamin. For seniors who are considering taking vitamin E supplements, it is crucial to approach this nutrient with caution. While vitamin E can support cardiovascular health, protect skin from damage, and provide antioxidant benefits, it is best consumed in moderation. The recommended daily intake of vitamin E for adults is around 15 milligrams, 22.4 IU, which is easily met through a balanced diet rich in nuts, seeds, and leafy greens. For those who want the benefits of vitamin E without the risk of toxicity, getting it from food sources rather than supplements is a safer approach. If a senior is taking vitamin E supplements, it is essential to consult with a healthcare provider to determine the appropriate dosage based on individual health needs and conditions. Additionally, seniors who are on medication for heart disease, blood pressure, or other conditions that affect blood clotting should exercise particular caution when using vitamin E, as its interaction with blood thinners can significantly increase the risk of bleeding. In conclusion, while vitamin E has well-documented health benefits, seniors must be mindful of the dosage they take to avoid harmful consequences. Excessive consumption of vitamin E, particularly in high-dose supplements, can dangerously thin the blood, increase the risk of stroke, and lead to other bleeding complications. By staying informed about the risks and benefits, and by prioritizing a balanced diet over high-dose supplementation, seniors can maintain optimal health while minimizing unnecessary dangers associated with vitamin E toxicity. 3. Vitamin B6, excessive intake. Vitamin B6, also known as pyridoxine, is an essential nutrient that plays a crucial role in many vital processes within the body. It is necessary for the production of neurotransmitters, the regulation of mood, the formation of red blood cells, and the metabolism of proteins, fats, and carbohydrates. For many seniors, vitamin B6 is commonly included in daily supplements, often as a remedy for fatigue, brain fog, or to improve mood and energy levels. However, while vitamin B6 is important for overall health, excessive intake, particularly over long periods, can lead to a dangerous condition known as sensory neuropathy, which can have a profound impact on quality of life. Sensory neuropathy refers to damage to the peripheral nervous system, which affects the nerves responsible for sensation and movement in the limbs. In the case of vitamin B6, excessive intake, especially beyond the recommended daily dose of 2 milligrams, can cause a toxic buildup of the vitamin in the body. Unlike water-soluble vitamins, which are flushed out by the body, vitamin B6 is stored in the tissues and can accumulate over time, leading to nerve damage. For seniors, who may be more sensitive to nutrient imbalances, the risk of experiencing toxic effects from vitamin B6 is higher, particularly if they are taking multiple supplements containing this vitamin or if they have existing health conditions. The symptoms of excessive vitamin B6 intake are often subtle at first, which can make it difficult to identify the problem early on. Some of the initial signs of toxicity include tingling or numbness in the hands and feet, a sensation of unsteadiness when walking, or a general lack of coordination. These symptoms are often dismissed as normal signs of aging, but they can actually be the early indicators of sensory neuropathy. As the condition progresses, seniors may experience more severe symptoms, such as difficulty walking, loss of balance, and impaired motor control. In advanced cases, it can even lead to a loss of fine motor skills, making everyday tasks like buttoning a shirt or holding a pen difficult to perform. The danger of vitamin B6 toxicity is that the nerve damage it causes is often irreversible. Once the peripheral nerves are damaged, they do not regenerate easily, and the loss of sensation and mobility can be permanent. In many cases, by the time the connection between the vitamin B6 intake and the symptoms is made, the damage is already done. This is particularly concerning for seniors, as the loss of balance and motor function can lead to falls, fractures, and a decline in overall independence. While the recommended daily intake of vitamin B6 for adults is around 1.3 to 2 milligrams, many supplements contain higher doses of the vitamin, sometimes exceeding 100 milligrams per tablet. This is well above the safe threshold and can increase the risk of toxicity, especially if taken over extended periods. Seniors who consume high doses of vitamin B6 in combination with other supplements, such as multivitamins or specific energy-boosting formulas, may unknowingly be putting themselves at risk for nerve damage. For seniors who are concerned about their vitamin B6 intake, it is important to consult with a healthcare provider to determine if supplementation is necessary. In most cases, a balanced diet that includes foods like poultry, fish, potatoes, bananas, and fortified cereals will provide enough vitamin B6 without the need for supplements. If supplementation is required, it is crucial to follow the recommended dosage and avoid exceeding the safe upper limits. To prevent vitamin B6 toxicity, seniors should carefully monitor the total amount of vitamin B6 they are consuming from all sources. This includes not only supplements but also fortified foods. It is also important to be aware of any symptoms of nerve damage and seek medical attention promptly if they occur. Early intervention can help prevent further damage and improve the chances of recovery. In conclusion, while vitamin B6 is an essential nutrient that supports brain function, energy metabolism, and overall health, excessive intake can lead to serious consequences, particularly for seniors. Sensory neuropathy, resulting from prolonged high doses of vitamin B6, can impair balance, coordination, and nerve function, leading to a decline in quality of life. Seniors should prioritize obtaining vitamin B6 through a balanced diet and consult with healthcare providers before taking supplements to ensure they are not at risk of toxicity. Moderation and mindful supplementation are key to maintaining health without inadvertently causing harm. 4. Vitamin C, high doses. Vitamin C, also known as ascorbic acid, is widely recognized for its powerful immune-boosting properties and its ability to combat the effects of aging through its antioxidant effects. It plays a vital role in collagen formation, wound healing, and protecting cells from oxidative damage. For many seniors, vitamin C supplements are a go-to remedy to support the immune system, reduce the severity of colds, and promote overall health. However, while vitamin C is essential, excessive intake, especially in doses higher than 1,000 milligrams per day, can have unintended and harmful effects, particularly on kidney health. One of the primary concerns with high doses of vitamin C in seniors is the potential strain it places on the kidneys. Vitamin C is a water-soluble vitamin, which means that the body typically excretes any excess through the urine. However, when taken in large amounts, vitamin C metabolizes into oxalates, compounds that can bind with calcium and form sharp, painful crystals known as kidney stones. For seniors whose kidney function naturally declines with age, the risk of kidney stones is significantly increased when consuming high doses of vitamin C regularly. The formation of kidney stones can be a slow, insidious process, with symptoms often not appearing until the stones become large enough to cause pain or block the urinary tract. The most common symptoms of kidney stones include sharp pain in the lower back or side, blood in the urine, and a persistent need to urinate, often accompanied by a burning sensation. In severe cases, the pain can be excruciating and may require medical intervention, such as surgery or shockwave treatment to break up the stones. For seniors, kidney stones can also lead to complications such as kidney infections, reduced kidney function, and, in extreme cases, kidney failure. The risk of developing kidney stones from excessive vitamin C intake is particularly concerning for seniors with pre-existing kidney conditions, or those who are already experiencing a decline in kidney function. As the kidneys become less efficient with age, they may struggle to eliminate the excess oxalates produced by large amounts of vitamin C, leading to an accumulation of these crystals in the kidneys. Furthermore, dehydration, which is common among older adults, can exacerbate the formation of kidney stones. Dehydration reduces the amount of urine produced, making it easier for oxalates to form crystals and for them to build up in the kidneys. Another issue with high doses of vitamin C is the potential for gastrointestinal distress. Excessive vitamin C can cause nausea, abdominal cramps, and diarrhea, especially in seniors who may already have sensitive digestive systems. These symptoms can disrupt daily life, leading to discomfort and a decrease in overall well-being. In some cases, prolonged gastrointestinal issues can also result in dehydration, which further compounds the risk of kidney stone formation. While vitamin C is an essential nutrient that supports many important bodily functions, it is important for seniors to understand the risks associated with overconsumption. The recommended daily intake of vitamin C for adults is 90 milligrams for men and 75 milligrams for women, with an upper limit of 2,000 milligrams per day. This amount is typically sufficient to meet the body's needs and avoid the adverse effects of excessive supplementation. For most seniors, obtaining vitamin C through a balanced diet rich in fruits like oranges, strawberries, and kiwi, as well as vegetables like bell peppers, broccoli, and spinach, is a safer and more effective approach than relying on high-dose supplements. If a senior feels the need to take vitamin C supplements, it is essential to consult with a healthcare provider to determine the appropriate dosage. Taking high doses of vitamin C should only be done under the guidance of a medical professional, particularly for those with pre-existing kidney issues or a history of kidney stones. In conclusion, while vitamin C is a powerful antioxidant that plays a crucial role in immune health and overall well-being, excessive intake, especially in doses above 1,000 milligrams per day, can lead to serious health complications in seniors. The risk of kidney stone formation, gastrointestinal distress, and potential strain on the kidneys makes high-dose vitamin C supplementation a dangerous practice for older adults. Seniors should aim to meet their vitamin C needs through a varied and balanced diet, and when supplements are necessary, they should do so under medical supervision to ensure their safety and well-being. 4 beneficial vitamins for seniors. Vitamin D, essential for bone and immune health. Vitamin D is often referred to as the sunshine vitamin because the body naturally produces it when exposed to sunlight. It plays a crucial role in calcium absorption, bone health, immune system function, and overall well-being. For seniors, maintaining adequate levels of vitamin D is essential for preventing a range of health issues, particularly those related to bone density and immune function. As we age, the body's ability to produce and utilize vitamin D from sunlight diminishes, making supplementation more important than ever to support optimal health. One of the primary functions of vitamin D in the body is its role in bone health. Vitamin D helps the intestines absorb calcium, which is vital for maintaining strong bones. Without sufficient vitamin D, the body cannot properly absorb calcium, leading to a decrease in bone mineral density and an increased risk of osteoporosis and fractures. For seniors, this is a particularly important concern, as bones naturally become weaker and more brittle with age. Osteoporosis, a condition where bones become fragile and prone to breaking, is more prevalent in older adults, and vitamin D deficiency is a major contributor to this condition. In addition to supporting bone health, vitamin D also plays a key role in immune function. It helps modulate the immune system, enhancing the body's ability to fight off infections and reducing the risk of autoimmune diseases. As we age, the immune system becomes less effective, and seniors are more susceptible to illnesses such as the flu, pneumonia, and other respiratory infections. A deficiency in vitamin D has been linked to an increased risk of these infections, as well as chronic conditions like cardiovascular disease and diabetes. By ensuring adequate vitamin D intake, seniors can strengthen their immune system and improve their ability to fight off infections and illnesses. Unfortunately, as we grow older, several factors contribute to vitamin D deficiency. The body's ability to synthesize vitamin D from sunlight decreases with age, especially in seniors who may spend more time indoors or live in areas with limited sunlight. Additionally, the skin's ability to produce vitamin D diminishes, and seniors may not get as much exposure to the sun, even during the warmer months. Furthermore, seniors may have difficulty absorbing vitamin D from food, especially if they have conditions like celiac disease, Crohn's disease, or other digestive disorders that affect nutrient absorption. The symptoms of vitamin D deficiency in seniors can be subtle and may not be immediately recognized. Some signs of deficiency include muscle weakness, bone pain, fatigue, and depression. Additionally, seniors with low vitamin D levels may experience a greater risk of falls, as vitamin D plays a role in muscle strength and balance. In some cases, the lack of vitamin D can lead to osteomalacia, a condition characterized by soft, weak bones that are more prone to fractures. To prevent these health issues, it is important for seniors to monitor their vitamin D levels regularly. The recommended daily intake of vitamin D for adults over 70 is 800 to 1,000 IU, but many seniors may require more, especially if they are deficient. While vitamin D is naturally found in foods such as fatty fish, egg yolks, and fortified dairy products, it can be difficult to get enough through diet alone. As such, vitamin D supplementation is often recommended, particularly for those who are at higher risk of deficiency. Vitamin D supplementation is generally safe, but it is important to avoid excessive intake, as too much vitamin D can lead to toxicity. High levels of vitamin D can cause a buildup of calcium in the blood, a condition known as hypercalcemia, which can lead to nausea, vomiting, weakness, and kidney problems. To avoid vitamin D toxicity, seniors should take supplements under the guidance of a healthcare provider and ensure they are taking the appropriate dosage for their needs. In conclusion, Vitamin D is essential for maintaining bone health, supporting immune function, and promoting overall well-being, especially in seniors. Given the challenges of getting enough vitamin D through sunlight and diet alone, supplementation is often necessary. Seniors should prioritize maintaining adequate vitamin D levels to prevent bone loss, improve immune function, and reduce the risk of falls and fractures. By doing so, they can ensure a higher quality of life as they age with greater strength, resilience, and immunity. Regular monitoring and consultation with a healthcare provider are key to ensuring that vitamin D supplementation is both safe and effective. 2. Vitamin B12. Vitamin B12, also known as cobalamin, is an essential nutrient that plays a vital role in the production of red blood cells, nerve function, and the synthesis of DNA. It is particularly well known for its significant impact on brain health and energy levels. As we age, however, our bodies may become less efficient at absorbing vitamin B12, leading to deficiencies that can contribute to a range of cognitive and physical health issues. For seniors, maintaining adequate levels of vitamin B12 is crucial not only for preserving memory and mental clarity, but also for sustaining overall energy and preventing debilitating conditions. One of the primary functions of vitamin B12 is its role in maintaining healthy nerve cells and supporting brain function. B12 is involved in the production of myelin, a protective coating that surrounds nerve fibers. This coating is essential for proper nerve transmission, ensuring that signals between the brain and other parts of the body are delivered efficiently. Without enough B12, myelin production decreases, leading to nerve damage and neurological issues such as numbness, tingling, and difficulty with coordination. Over time, a deficiency in vitamin B12 can impair cognitive function, leading to memory loss, confusion, and even dementia in severe cases. For seniors, the cognitive effects of vitamin B12 deficiency can be particularly concerning. Many older adults may experience memory lapses or a general decline in mental sharpness, which they attribute to normal aging. However, these symptoms may be a result of B12 deficiency rather than simply the aging process. Research has shown that seniors with low levels of B12 are at a higher risk of cognitive decline, including memory impairment and difficulty concentrating. In some cases, the cognitive decline associated with B12 deficiency can be reversed or improved with appropriate supplementation, making it an important factor in maintaining mental clarity and memory as we age. In addition to supporting cognitive function, vitamin B12 is essential for energy production. It plays a key role in the metabolism of fats and carbohydrates, helping the body convert food into energy. Seniors who are deficient in vitamin B12 often report feelings of fatigue, weakness, and lethargy, which can significantly impact their quality of life. These symptoms are often mistaken for the natural effects of aging or other health conditions, but they may be alleviated by restoring adequate levels of B12. By supporting energy production at the cellular level, B12 helps seniors maintain the stamina and vitality needed for daily activities, from walking and exercising to managing household tasks. A deficiency in vitamin B12 can also lead to anemia, a condition characterized by a lack of healthy red blood cells, which can further contribute to feelings of fatigue and weakness. Anemia caused by B12 deficiency is often referred to as pernicious anemia, and it can cause symptoms such as paleness, shortness of breath, dizziness, and heart palpitations. Without intervention, pernicious anemia can worsen over time, leading to more serious complications. By ensuring adequate intake of vitamin B12, seniors can prevent this type of anemia and the associated symptoms. The risk of vitamin B12 deficiency increases with age, as the body's ability to absorb B12 from food diminishes over time. Older adults are more likely to experience digestive issues that impair B12 absorption, such as reduced stomach acid production or gastrointestinal disorders like Crohn's disease or celiac disease. In addition, certain medications commonly prescribed to seniors, including proton pump inhibitors, PPIs, and metformin, can interfere with B12 absorption. This makes it essential for seniors to monitor their B12 levels and consider supplementation if necessary. The recommended daily intake of vitamin B12 for adults is 2.4 micrograms, but seniors may require higher amounts due to absorption issues. B12 is naturally found in animal products such as meat, fish, poultry, eggs, and dairy. For seniors who follow vegetarian or vegan diets or have difficulty absorbing B12 from food sources, supplementation may be necessary. B12 supplements are available in various forms, including oral tablets, sublingual tablets, which dissolve under the tongue, and injectable forms, which can be particularly useful for those with severe deficiencies or absorption issues. It is important for seniors to consult with their healthcare provider before beginning B12 supplementation to determine the appropriate dosage and form of supplementation. In most cases, restoring B12 levels can have a significant positive impact on mental clarity, energy levels, and overall well-being. In conclusion, vitamin B12 is a critical nutrient for maintaining cognitive health, energy production, and overall vitality in seniors. Deficiency in vitamin B12 can lead to memory loss, fatigue, and other debilitating symptoms. But the good news is that it is easily addressed with proper supplementation. By ensuring adequate intake of this essential vitamin, seniors can support brain health, prevent fatigue, and maintain a high quality of life well into their later years. Regular monitoring of B12 levels and working with healthcare providers can help seniors maintain optimal health and well-being. 3. Vitamin K2, bone and heart protection. Vitamin K2 plays a vital and often overlooked role in maintaining both bone and heart health, particularly in seniors. While vitamin K1 is well known for its role in blood clotting, vitamin K2 is essential for the proper utilization of calcium within the body. It helps ensure calcium is deposited in the bones and teeth where it is needed, and prevents it from accumulating in the arteries and soft tissues where it can cause harm. As people age, the body becomes less efficient at managing calcium, and the risk of conditions like osteoporosis and cardiovascular disease increases. This makes vitamin K2 particularly important for seniors looking to maintain strong bones and protect their cardiovascular health. One of the most critical functions of vitamin K2 is its ability to activate proteins that help regulate calcium usage in the body. It activates osteocalcin, a protein that is involved in binding calcium to the bone matrix. Without sufficient vitamin K2, calcium is not properly incorporated into bones, leading to weaker bone structures and an increased risk of fractures. This is a significant concern for seniors, as bone density naturally decreases with age, making the bones more susceptible to breaks and fractures. Vitamin K2 also activates matrix GLA protein, MGP, which helps prevent the accumulation of calcium in the arteries, thereby reducing the risk of arterial calcification and ensuring that calcium stays in the bones where it is most beneficial. Vitamin K2's role in preventing arterial calcification is crucial for cardiovascular health. As we age, calcium can build up in the walls of arteries, leading to the hardening and narrowing of blood vessels, a condition known as atherosclerosis. This can contribute to high blood pressure, heart disease, and stroke. Vitamin K2 helps prevent this by activating MGP, which inhibits the deposition of calcium in the blood vessels, keeping the arteries flexible and healthy. Research has shown that higher intake of vitamin K2 is associated with a lower risk of coronary artery disease and other cardiovascular issues. For seniors, ensuring adequate intake of vitamin K2 can be a key factor in maintaining heart health and reducing the risk of cardiovascular events. Vitamin K2 is found in fermented foods like natto, fermented soybeans, sauerkraut, and aged cheeses, as well as in animal products such as egg yolks, liver, and meat from grass-fed animals. However, many seniors may not consume enough of these foods to meet their vitamin K2 needs. As a result, supplementation may be necessary for those who are not able to get sufficient amounts from their diet. Vitamin K2 supplements, particularly those containing -7 Malawian kwaches, a highly bioavailable form of the nutrient, are widely available and can help ensure adequate intake. -7 Malawian kwaches is known for its long half-life, meaning it remains active in the body for an extended period, providing lasting benefits. For seniors who are concerned about bone health or cardiovascular risk, ensuring adequate intake of vitamin K2 can be a simple and effective way to support both bone density and heart health. The recommended intake of vitamin K2 varies, but a dose of 90 to 120 micrograms per day is generally considered beneficial. Seniors who are at higher risk for osteoporosis or cardiovascular disease may need higher doses. It is important, however, to consult with a healthcare provider before beginning supplementation, particularly for those who are on blood-thinning medications like warfarin, as vitamin K2 can interact with these medications. In conclusion, vitamin K2 is an essential nutrient for maintaining strong bones and a healthy cardiovascular system, especially in seniors. Its role in directing calcium to the bones and preventing its accumulation in the arteries helps prevent osteoporosis, fractures, and cardiovascular disease. As seniors age, ensuring adequate vitamin K2 intake, through diet or supplementation, becomes increasingly important to support overall health. By making vitamin K2 a part of their daily health routine, seniors can help protect their bones and arteries, promoting long-term well-being and vitality. 4. Magnesium promotes relaxation and nerve health. Magnesium is often referred to as the master mineral due to its involvement in over 300 biochemical reactions within the body. It plays a crucial role in regulating muscle and nerve function, supporting immune health, maintaining heart rhythm, and helping with the production of energy. For seniors, magnesium is especially important as it helps to alleviate many of the discomforts that can arise with aging, such as muscle cramps, restless legs, anxiety, and difficulty sleeping. Despite its many benefits, magnesium deficiency is common in older adults, often due to dietary gaps or the use of certain medications that deplete magnesium levels in the body. One of the key benefits of magnesium in seniors is its ability to promote relaxation and reduce muscle tension. As we age, muscles can become stiffer and less flexible, leading to discomfort and pain. Magnesium helps regulate muscle contractions and prevents excessive tightening, which can help reduce cramps, spasms, and overall muscle stiffness. Many seniors experience nocturnal leg cramps, which are painful and disruptive to sleep, but magnesium can alleviate these cramps by helping muscles relax. Magnesium is also essential for maintaining proper nerve function, which plays a role in preventing tingling, numbness, and other nerve-related issues that often affect the elderly. In addition to its muscle-relaxing properties, magnesium is vital for maintaining healthy nerve function. It helps regulate the electrical signals that travel along the nervous system, allowing for proper communication between the brain and other parts of the body. Seniors often experience nerve-related symptoms, such as peripheral neuropathy, a condition characterized by pain, tingling, and numbness in the hands and feet, which can be caused by factors like diabetes, aging, or poor circulation. Magnesium helps protect the nerves from damage and supports the repair of nerve tissues. Ensuring adequate magnesium levels may improve symptoms related to nerve dysfunction and promote overall comfort and mobility. Magnesium also plays a critical role in supporting heart health, which is especially important for seniors. It helps regulate blood pressure, maintain a steady heart rhythm, and support the proper function of the cardiovascular system. Magnesium helps relax the blood vessels, which can improve circulation and reduce the risk of high blood pressure. As we age, the risk of hypertension increases, which in turn raises the risk of heart disease and stroke. Ensuring adequate magnesium intake can help maintain healthy blood pressure levels and improve cardiovascular function, reducing the strain on the heart and minimizing the risk of heart-related issues. Another significant benefit of magnesium is its ability to improve sleep quality. Many seniors struggle with insomnia or disrupted sleep patterns, which can be caused by various factors such as anxiety, pain, or discomfort. Magnesium plays a role in regulating neurotransmitters that promote relaxation and sleep. It helps activate the parasympathetic nervous system, the branch of the nervous system responsible for calming the body and preparing it for rest. By enhancing the body's ability to relax, magnesium can improve both the quality and duration of sleep, which is essential for overall health and well-being. Despite its many benefits, magnesium deficiency is common among seniors, especially those who have dietary restrictions, take certain medications, or have gastrointestinal issues that affect nutrient absorption. Magnesium-rich foods include leafy green vegetables, nuts, seeds, legumes, whole grains, and fish. However, many seniors may not consume enough of these foods to meet their magnesium needs, which is where supplementation can play a role. Magnesium supplements come in various forms, including magnesium citrate, magnesium glycinate, and magnesium oxide, each with varying degrees of bioavailability and absorption. For seniors, Magnesium glycinate is often recommended as it is gentle on the digestive system and highly absorbable. The recommended daily intake of magnesium for adults is around 320 to 420 milligrams, but seniors may need more depending on their health status and dietary intake. It's essential for seniors to consult with a healthcare provider before starting magnesium supplements, especially if they are on medications like diuretics or proton pump inhibitors, which can interfere with magnesium levels. In conclusion, magnesium is a powerful mineral that plays a crucial role in promoting relaxation, supporting nerve health, regulating blood pressure, and improving sleep quality. For seniors, ensuring adequate magnesium intake is essential for maintaining physical and mental well-being. Magnesium can help alleviate common age-related discomforts, such as muscle cramps, anxiety, and sleep disturbances, while also protecting the cardiovascular system. By prioritizing magnesium in their diet or through supplementation, seniors can improve their overall quality of life, reduce the risk of chronic health issues, and maintain greater independence and mobility as they age. Aging brings both wisdom and vulnerability, and with it comes a shift in how our bodies process nutrients. While many vitamins and supplements are marketed as essential for maintaining health, it's important to recognize that not all supplements are beneficial for seniors. In fact, some can cause harm when taken inappropriately or in excessive amounts. The body's ability to absorb and utilize nutrients diminishes with age, making it crucial for seniors to make informed and mindful decisions about which vitamins to include in their routine. Choosing the right vitamins can significantly improve health, help maintain independence, and enhance overall quality of life. Nutrients like vitamin D, B12, magnesium, and vitamin K2 play critical roles in supporting bone health, cognitive function, muscle relaxation, and heart health, key areas that can decline with age. However, it's essential to understand that the needs of a senior's body are different from those of a younger individual. For example, certain vitamins that were once beneficial may become harmful when taken in excess, such as vitamin A or E, which can lead to toxicity and adverse effects. The key to aging gracefully lies in making informed decisions based on knowledge about how the body processes nutrients at different stages of life. Seniors should prioritize a balanced diet rich in whole foods and consult with healthcare providers before starting any supplementation. By focusing on nutrient-rich foods and taking the right vitamins in appropriate doses, seniors can mitigate risks, manage age-related health concerns, and continue to lead active, independent lives. Through careful choices, seniors can not only survive but thrive in their later years.